explain to everybody what that is?
Sure. Mommy makeover doesn't really refer to any specific procedure. Mommy makeover does refer to essentially constellation of procedures to address specifically what changes have occurred as a result of being a mommy. So, for instance, breast tissue definitely sags after natural birthing processes, and the engorgement of milk, and then that let down, and all those ligaments are stretched, and so essentially the boobs may not be as high as they used to. And so one of the more common things that we do as part of our mommy makeover is breast enhancement, which is usually some combination of a lifting technique to improve the sagging, as well as some sort of an implant to improve the volume. At the same time, we all know that the bellies get bigger, and as a consequence, things don't always return back to normal after childbirth. And so we do any combination of liposuction for fat reduction, as well as a tummy tuck, which includes reconstruction of the abdominal wall, which has, of course, been stretched out, as well as skin tightening, so that women don't feel like they have all these extra rolls of loose, soft skin. They don't feel comfortable wearing bikinis. And then that's one of the idea specifically for me of the tummy tuck, is so that patients can get back to two-piece bathing suits. And so in a sentence, there's no real set specific procedures, but for me, it includes a combination of breast enhancement with body contouring.
So you can do more than one procedure at a time?
Oh, absolutely. Procedures are determined based on individual needs and desires, for sure. But, part of our lengthy consultation process is to determine, medical candidacy, how healthy you are, and then there's just certain things that you shouldn't do. Like I don't do procedures that last more than 6 hours. I mean, I think that's just unnecessary. And sometimes I tell patients, you can't fix the whole house at once. We can do the roof and the kitchen, but we're going to have to see the floors and painting the walls for another time. And it's all based in safety. I mean, I would really love to put them in a machine, and then they come out, 10, 15 minutes later and get everything done. Unfortunately, it doesn't work like that. So usually the plan of attack is address what bothers them most first, and that's usually how you keep patients motivated and interested and happy with their decision.
Well, this lady who actually called one of our other shows, during their show, called your office and said, whoever answered the phone was so knowledgeable, but she found out something that she's going to have to wait a little while, because she told them that she smokes, and they said they would prefer her not to smoke before the surgery. Is that right?
Yes, there's definitely some procedures that I would prefer not to do on somebody who smokes. But, like this is like breast lift with implants, tummy tucks. These are all along the procedures that I would prefer a non-smoking patient. There's other procedures that it's just strongly recommended that they don't smoke. For instance, you could do a breast aug, or you could do a liposuction. And while the healing time might not be as quick, it's not an absolute contraindication to do these procedures. It's just, it makes more sense if you're investing, this much time and your body and money to do the best for your outcome. But, my doctor tells me that I shouldn't have red meat, and I mean, I love steak. And so, we work with patients. Certainly there is a do not harm. You're not going to put anybody in harm's way.
Right.
But we understand patients are humans, and there's some things you can and can't, sort of improve, and you sort of work with what you got.
Well, she must want this pretty bad, because she told us that day she's put the cigarettes down. She's going to go on the patch. She wants to have this surgery done, and she heard you talk last month. And I think what I understand when it comes to plastic surgery in women, that they have to feel comfortable with the doctor. it's not just goes on recommendations, that they want to feel comfortable. And somehow your voice, your knowledge, when you were on with us last month, did the trick with her.
I appreciate that. I think, in fact, I think the big mistake that maybe some doctors make is thinking that they're only treating that they're only treating a body part. And this is, unfortunately, this is pretty common in medicine. I mean, right now with the pressures of healthcare and medicine, you almost feel like you got to be in and out in an office. It's very hard to build that relationship. It's very different in cosmetic surgery. I mean, I feel like I'm not just working on somebody's body part. And I can tell you that there is definitely an emotional transformation that occurs with these procedures. I mean, I can't tell you how many times that patients come in for a facelift, and they come in and their hair is not done and they don't have makeup on and they're wearing, their sweatpants. And then, 6-8 weeks later after their facelift, they come back in, and not only are things a little bit tighter and a little bit higher, but we now have a patient who's, she's probably wearing a little bit higher skirt, maybe a little bit lower plungy neckline. The hair is done. There's new makeup, high heels, and there is definitely a new air of confidence. The whole idea is, you got to make patients look the way they feel, and you can't really figure that out unless you sit down and talk to patients.
I have a question, and we have a lot of questions from listeners that have been coming up for the last couple of weeks that knew you were coming on. But I will see women out there who have very large lips. As a doctor, when you sit down with someone, if you think someone who wants a breast augmentation or something with the lips that is not going to look good, I mean, do you say something?
Oh, of course. And this goes back to how good of a relationship you can have with your patient. I think the decision to have surgery is very, I tell patients this all the time, and, I work a lot with analogies to help patients sort of understand and we can communicate. But for me, the decision to move forward with surgery is a lot like marrying somebody. And if your communication is not perfect or as good as it can be before surgery, well, guess what? It doesn't get better after surgery. Well, those people who love you best sometimes tell you things you don't want to hear. And so you may come up with this idea to do something procedure, but, if I feel like it's not in their best interest, even if they think there is, and to the point that you could lose that relationship and lose that client, I mean, but, you have I feel like I have an obligation to patients to make them look better and improved, but not necessarily different or deformed.
So more natural look.
Oh, absolutely. I mean, when we're talking about faces, what I'm promising patients is that you should be able to sit across a dinner table from somebody and they not know that you had something done. And obviously, when we look at TV in Hollywood, that's not exactly what we see. But, the idea is not to advertise on the face. The idea is, especially when it comes to face, that they just, they get questions like, did they cut their hair or did they lose weight? But not did they have the facelift of who your doctor was. In terms of body contouring, it depends. I mean, some patients get a dramatic result, and some patients are looking for more dramatic results. And they do so well, it's hard to hide. I mean, it's hard to tell somebody you had a 30-pound weight loss in 3 weeks, without some sort of intervention. So
right.
in some cases, it's so dramatic that's obvious. But in terms of, faces and final results, no, I mean, the idea is looking natural and refreshed, but certainly not altered.
Hey, Michael, we're going to go to break, but first tell people the name of your practice.
Our practice is called Gentera. We're located on Miami Beach, right next to Mount Sinai Hospital. And our phone number is area code 305-424-5775.
And give everybody your website address also.
Sure. Our website is www.gentera-med.com. That's GENTERA MED.
Okay, we're going to go to break, Michael, and we come back. I've got so many questions from listeners for you. We'll be right back.
Are you aiming for a refurbished, timeless look or to boost your appearance? South Florida's Dr. Michael Rodriguez provides the most up-to-date cosmetic procedures designed to bolster your regeneration and anti-aging, all while helping you feel better about you. Gentera Center for Regenerative Medicine and Dr. Rodriguez are focused on helping you restore your youth and beauty with a full menu of advanced cosmetic procedures that are proven to rejuvenate the face and body while reversing the effects of aging so you feel like a refreshed version of yourself. See why so many patients recommend Dr. Rodriguez to their friends and relatives. Call today to set up your consultation at 305-424-5775. Mention the Ask the Experts radio show and receive 15% off any of our services. To find out more about Gentera and Dr. Rodriguez, visit www.gentera-med.com.
And we're back. We're here. We do a plastic surgery show every month with Dr. Michael Rodriguez. And what we did for the last couple weeks is we went to Twitter and our Facebook and had women, because that's who we mostly have on this show is women, to write us questions for Dr. Rodriguez. And I guess this lady here, Michael, I guess she's looking to have a facelift done. And the first question she wanted to know is, how painful is it?
You know, I think the great news with facial rejuvenation is that these procedures, for the most part, are not painful. I would say soreness and tight, but I would not say overtly pain. And just to give you an example, you know, I obviously want patients to be comfortable after the procedure. I definitely prescribe, you know, pain medications for all my patients. I usually prescribe 30 pills, dispense 30 pills. I can't tell you on my hand, and I've done over 2,000 of these procedures, how many patients, you know, if any, have asked me for more pain pills or that they've even used them all. I mean, I've had patients tell me that they haven't used any, that they've used one or two because they thought they were going to be in pain and were expecting pain, but the pain never arrived. So again, facelift procedures are not terribly painful.
Now, how much work that was another one of her questions, how much work would she have to miss?
You know, it depends on your level of comfort with how you look. There's two types of recovery for me. There's what I refer to as medical recovery, and then there's social recovery, especially when we're talking about faces. And this is, of course, very different than the body. You know, medical recovery for me from a facelift, it starts off with bed rest for the first 2 or 3 days with head elevation. That means you're going to be sleeping in a recliner and on pillows, and you're going to have your activity restricted till about 5 days. After 5 days, you're actually at about 90% of your daily activities. If your employment includes emails on the phone, or you don't have to face clients or customers, patients frequently go back to work as early as 5 to 7 days.
Wow.
If we're talking about sales, or where presentation is key, and you really have to look the part, then I would recommend that you take a little bit longer time, anywhere from a week to 10 days to maybe up to 2 weeks. It really depends on how much you bruise. Now, if you wanted to look wedding perfect, you know, your daughter's getting married, and you're going to be looking at these photos for the rest of your life, I usually recommend patients take 4 weeks just to look, you know, wedding day picture perfect. Usually, though, for instance, body procedures are much easier because there's no social recovery. Essentially, if you have a liposuction done, you're sore and you're recovering for a few days, but you put on a shirt or your dress or your cover on, and nobody can really tell what's going on. With facelift procedures, if you're just doing the face and neck, it's harder to cover, but the good news is that your recovery isn't as long as some people think. The social recovery, of course, varies depending on level of bruising, but the medical recovery and the discomfort is actually pretty short-lived.
What about scars, Michael? Can scars be seen?
You should be able to sit across a dinner table from somebody and they not know you had a facelift done. So what that means is whether we're talking about the neckline, the jawline, around the ears, the shape of the ears, the form of the ears, the scars, the width, the color, the texture, the location, it should not look like they had a facelift done.
Are you a father by any chance?
Am I a father?
Yes.
Father of 3.
Okay.
Yes.
Is any of them a daughter?
I have 2 daughters.
Okay,
then this is daughter, and I have a 7-year-old daughter.
Okay, so you'll like this question. So we have a mother here whose daughter, 18 years old, they made a promise to her if she brought her grades up, they would get her breast augmentation. Is that too young? Would you let your daughters have breast augmentation at 18 years old?
Ooh, those are 2 different questions. So, 18 years old, I could tell you it's not uncommon for women of that age to have breast procedures. Now, most of the breast procedures at that age are used to address what they perceive as deformities. For instance, if one breast is much larger than the other, I think it's very appropriate, and you don't even have to wait to 18. You can do it before 18, 15, 16 years old, usually 2 or 3 years after their first period, you can do procedures for symmetry. It's also not uncommon if they're, large, very large-breasted women. Again, you don't have to wait to 18. If their back hurts, they feel subconscious, they won't wear anything but large sweaters or hoodies because they're trying to cover their chest. They don't want to be teased. They don't want that kind of attention. Then it's also appropriate to do that before age 18. We don't do anything or use any device that's not FDA approved. Right now, saline breast implants are approved for women who are 18 years of older. Silicone or gel implants are only FDA approved for patients who are 21 years and older. Now, from a personal standpoint, I would not buy my daughter breast implants at age 18. That's me personally. However, if patients have, if it's a well-thought process, if it's nothing that's going to do any harm long-term, if it's not a crazy request, for someone who has no breasts, if they have A cups, if they have, 0 breast tissue called hypomastia, I don't think it's inappropriate for them to get a modest augmentation.
I think that's a good answer. We just got a text in. I'm going to try to get as many of these questions as I can. Do you work on male when it comes to, I guess, the belly area?
Oh, yes.
So he wants to know if you do liposuction on a male over 70 years old.
Over 70 years old, that patient would obviously require a full medical evaluation, including a physical exam by me and make sure that it's an appropriate surgery. It's really all about risk versus benefits. There's a consequence to every decision that we make, from getting up in the morning and jumping in your car to what we eat. And essentially it depends on what that risk versus benefits. I don't like to say carte blanche, yes or no, based on age or based on body type or based higher than somebody who's 40.
So would they go to find out would they go to their internist or would you examine them?
Well, I would definitely examine them for surgical candidacy.
Yes.
But in terms of medical candidacy, I would want their physician on board. And if there were, if there were any other more complicated problems, then we would ask for even a specialist. For instance, if there was a specific cardiac condition, then I would want a cardiologist, not just the internist. I would, if there was any sort of kidney issue, I would want the nephrologist, or essentially for sure an internist when it's appropriate, and if warranted, a specialist.
They also want to know, what other male procedures do you do?
Just about every single procedure that is available for women, I've performed on men. They're not as common as patients as women, but I can think of pretty much every procedure that I've done on women, except for, of course, the vaginal procedures. Men have requested for them. So, I have done augmentation on transgenders. I have done six-pack lipo etching on bodybuilders. These are or personal trainers. I've done, the most common for men is gynecomastia reduction. So if what they typically refer to as man boobs.
Yes.
You can do either anything from a gynecomastia to even, the more severe cases, you're almost doing like a breast lift, breast reduction type procedure. So, every procedure that's available for women, for the most part, is available to men. I find that men make up about 30 to 40% of my practice.
Another question do you charge for consultations?
Right now at this point, they are complimentary.
Okay.
Our consultations are complimentary. We do try to determine candidacy for consultations, but absolutely, consultations are complimentary. So the information is free.
Okay, so if you would like to call Dr. Rodriguez's office, the number there is 305-424-5775. And Doctor, you've got a great website. It's Gentera, GENTERA -med.com. And it's just so easy just sitting here listening to you. It's almost like you should maybe have been a teacher.
I appreciate the comments. As a matter of fact, one of the things that I do love is teaching. And I am on faculty at Nova Southeastern. And recently, I started my fellowship program. So for 12 months out of the year, from July to July, I have my fellow with me so that he can one day become a board-certified cosmetic surgeon. So he's been with me for 4 months, and it's really great to work with somebody who has a mind, who's looking really from your perspective as to how to perform the same procedures. It's the same craft that I'm at, and hopefully, we get a number of surgeons, who could say that, I learned from Dr. Mike Rodriguez. So yeah, I appreciate the comments. In fact, it's one of the things that I love most about my job.
Well, it's very obvious. Listen, Dr. Rodriguez will be back with us again next month, and we'll be letting you know when he'll be back on. Hey, Dr. Rodriguez, thank you so much for coming on today.
My pleasure. Thank you for having me.
We'll see you down the road. So that's the end of another Ask the Experts. We'll be back next Thursday at 5 o'clock with more experts here in South Florida. Have a good weekend. Peace and love. We're out.